What rules govern virtual psychiatry, controlled substance prescribing? Imagine being able to see a psychiatrist from your living room and get the medications you need without leaving home. That's the promise of virtual psychiatry, but there are important rules to keep everyone safe. When it comes to prescribing controlled substances during telehealth visits, federal, state, and institutional rules work together to guide doctors. The main federal agency involved is the Drug Enforcement Administration, or DEA. They regulate how controlled substances are prescribed remotely. Before the COVID-19 pandemic, doctors had to see patients in person before prescribing medications like certain antidepressants or anti-anxiety drugs. During the pandemic, temporary rules allowed doctors registered with the DEA to prescribe these medications without an initial, in-person visit. These flexibilities are still in place until at least 2025. Starting March 21, 2025, new DEA rules will let doctors prescribe Schedule 3, 4, and 5 controlled substances for opioid use disorder through telemedicine, including phone calls, without an initial in-person exam. Doctors can give a 6-month supply at first, and follow-up prescriptions can be done remotely or in person. Before prescribing, doctors must check the patient's prescription drug monitoring program data to see if they have other prescriptions that could cause problems. Pharmacists filling these prescriptions must verify the patient's identity with government-issued ID. The DEA is also creating special telemedicine registrations for providers and platforms to prescribe controlled substances remotely. These will require showing a legitimate need and following federal standards. Some specialists, including psychiatrists, may qualify for advanced registrations that allow prescribing Schedule 2 through 5 drugs under certain conditions. Veterans Affairs doctors have their own rules, allowing controlled substance prescribing after an initial in-person exam within the VA system. State laws vary a lot. Some states restrict or prohibit telepsychiatry prescribing of controlled substances, while others allow it with rules like follow-up visits. Providers must follow the law where the patient is located during the telehealth session. Many states also requiring checking the state prescription drug monitoring program before prescribing to prevent misuse. Healthcare institutions like hospitals or behavioral health centers may have their own rules about prescribing controlled substances via telehealth. These often include safeguards like on-site oversight or specific protocols. Telemedicine platforms that help with controlled substance prescriptions must register with the DEA and follow all federal and state rules. When setting up a telehealth appointment for controlled substances, providers need to verify the patient's identity, use secure platforms, and document everything properly. Electronic prescribing systems make it easier and safer to send prescriptions directly to pharmacies. In summary, virtual psychiatry controlled substance prescribing is guided by federal DEA rules, state laws, and institutional policies. Recent changes have made telehealth more flexible, especially for addiction medications, but safeguards like prescription drug monitoring checks, identity verification, and proper documentation remain essential. These rules help ensure patients get the medications they need safely while preventing misuse or diversion.